so happy to be here this afternoon. It's been really great to see everyone engage with all of the sessions throughout this two-day summit, and I am really happy to be able to share a little bit more about the Research and Policy Division with the audience. I have the subheading, Developing the Evidence Base and Informing Policy to Advance Health Equity. And just in case anyone has forgotten, I am Megan Douglas, Assistant Professor in the Department of Community Health and Preventive Medicine and the Director of Research and Policy for the National Center for Primary Care. I wanted to start out just with a moment of gratitude to our research and policy teams. You've seen many of these individuals throughout this event. They have really been proactive and really worked tirelessly to get all of this coordinated, and really thankful for them. We often refer to ourselves as a small but mighty team. I usually have this slide at the end, but then sometimes run out of time, and wanted to make sure that I give thanks to the team today. And then also want to give a special thank you. You heard from Dr. Ann Gagliotti right before lunch about the Southeast Regional Clinicians Network. Dr. Gagliotti served as the Director of Research for the National Center for Primary Care for about the last 5 years. She and I have had the opportunity to work very closely together, and often when someone leaves an institution, they really leave, but we have really been fortunate that Dr. G has been very intentional about staying engaged and continuing to work with the NCPC team and creating new collaborations and partnerships with her colleagues at Case Western. So I had been the director of the policy division in the NCPC for I've been working on policy issues with the NCPC for about 9 years now. And even when Dr. G was here, we made sure that the research and policy divisions worked very closely together in a lot of aspects, which I will get into in just a couple of minutes. But we really try to make sure and be very intentional about our research informing policy, and that we are asking research questions that are relevant to policy and can be used to develop that evidence base for policy. And want to tie into some of what you've heard throughout the summit with some of the workforce and faculty development that we do within the research and policy divisions of the NCPC. We contribute to the faculty development program. We also contribute to the academic medicine rotation, which is offered to Morehouse School of Medicine medical students. I have directed the health policy and advocacy rotation for about the last 7 years. And we also try to make sure that we have student research, we serve as student research advisors, we have graduate research assistants, and provide mentorship to students across Morehouse School of Medicine and external institutions. So I think one thing that really sets the NCPC research portfolio apart is that we focus and center all of our research on equity, which should not be a surprise given the themes and content of the summit so far. But I think it's really important to highlight just how we do that and how expansive our approach is to research. We do health services research. We do a lot of secondary data analysis and evaluation. We have a nationally representative Medicaid claims database that we do a lot of work with. We do spatial analyses, practice-based research, community-based research, and then policy analysis and legal epidemiology. And this slide just shows a few of the articles that we have published and kind of the, again, expansive nature of the portfolio that we have and the work that we do, all centered around health equity. On the policy side, I mentioned legal epidemiology. That is the space that I like to live and breathe in policy analysis. Community engagement, I'm going to provide some highlights for some of the projects, and then you'll hear a lot more about one of our projects that we are really engaging with the community. Informing policy, again, we try to make sure that our research is informative to policy and that we translate that research into formats that policymakers, community advocates, community members can access the research findings, recognizing that probably a very small proportion of our stakeholders are actually reading the journal articles that we're publishing. And I just think that we try to develop those partnerships to expand upon our own research method and capacity, and also to make sure that we are doing that informing of policy. So we have partnerships across other academic institutions and research units. We are part of different coalitions. Really great example is the report that we released yesterday with the Primary Care Collaborative. We tried to make sure that the information in that report is informative to all of our primary care stakeholders and policymakers. We also do a lot of submitting of public comments and responding to requests for information, making sure that we are keeping that line of communication to state and federal government policymakers, and making sure that they're aware of the evidence-based and research findings as they're developing and implementing policies. I am going to just provide a few highlights of some of the work that we do and some of the work that we've been doing most recently. You've heard about some of this throughout the summit, but we, as part of the National COVID-19 Resiliency Network, and actually even before we were awarded that project, we started doing COVID-19 research. Given that we are very familiar with the prevalence of health inequities across almost all other health outcomes, we expected and suspected that there would be a disproportionate impact of COVID-19 on racial and ethnic minority and other underserved communities. So we started out very early in the pandemic, identifying data sources and trying to identify and assess whether there were disparities and what those disparities look like. We developed a research report very early, April or May of 2020, with some data in Georgia, and did not submit that for peer review. We thought it was very important at that point to make sure that the Department of Public Health and the frontline workers trying to mitigate the impact of COVID-19 had this information. So we started with that, and since then we have done a lot more research looking at how the pandemic has affected communities, but also things like what is the variation in reporting of race and ethnicity data for COVID-19 cases and deaths. We know that the data has been, the quality of the data has been poor, and if we do not have good data, we can't truly identify the effects of the pandemic on communities. We also have talked a little bit about the digital health tools study. We started this project prior to the pandemic in 2019. It's a partnership with the United Health Foundation. And the focus was really to look to assess the adoption and use of digital health tools by primary care clinicians in Georgia, North Carolina, Kentucky, and Tennessee. We had a very different outreach and recruitment strategy prior to the pandemic, and expected that we would be traveling across these states and really getting to speak with clinicians about their experiences. But we did pivot when the pandemic hit, and we were concerned that the clinicians we wanted to hear from would not have the time, energy, or ability, capacity to engage with us on this study. But it actually turned out to be just the opposite. They were utilizing digital tools to provide services throughout the pandemic. and they were, very willing to continue to share this information and this impact with us. We ended up surveying over 1,200 primary care clinicians across those 4 states. More than half of those who were using telemedicine during the pandemic reported that it was their first use of telemedicine. And we actually saw some, I will say, decent satisfaction rates. These were higher satisfaction rates than we expected with the experiences of clinicians using telemedicine and electronic health records. So we're continuing to analyze the data collected during this study, and we'll be disseminating those findings very broadly over the next year. We're also doing some work around maternal health and structural racism. Dr. Gagliotti and colleagues published a paper using the Medicaid claims data earlier this year that was looking for whether states had achieved equity, and if there were states that had achieved equity in maternal morbidity in the Medicaid population. They actually, found very, very deep inequities, which we know exist with regard to maternal morbidity. But we are now building on that study and applying a construct of structural racism that was developed by Jeff Doherty and colleagues at Johns Hopkins University. We're applying this construct of county structural racism to the maternal morbidity indicators in our Medicaid claims. And preliminary finding, this is not published yet, but we did find significant associations between county structural racism and maternal morbidity indicators, especially, so very significant associations for Black Medicaid enrollees. 40%, 56%, and 47% more likely as the level of county structural racism increased to experience a maternal morbidity. And then the last project that I'm going to highlight during this time, and this will be our transition into the next session. This is a project I can't even really express how excited I am about this project for many reasons. Advancing health equity in the city of East Point. This is a project funded by the U.S. Department of Health and Human Services, Office of Minority Health. We were one of 6 demonstration projects that were funded under this program from across the country, and the only one in Georgia. This is an award for up to 3 years and up to $1.1 million in funding. And one of the reasons that I'm really excited about this is that the program, the OMH program as a whole, is really focused on the role that policy plays in exacerbating inequities. And we're also looking at it as how do we identify policy solutions to advancing health equity. I think it's really exciting to really have this opportunity to look specifically at the role of policies and to measure the effect of those policies. And really the predominant driver of this project is the East Point community. East Point is a city in Fulton County, neighbors the city of Atlanta, about a little over 35,000 residents. It's predominantly Black and has a long history of structural racism in the community that has had negative impacts on the health outcomes of the residents of East Point. East Point leadership, which you will hear a lot more about in the next session, has committed to advancing health equity. And City Council adopted an equity resolution in 2019. And through that equity resolution, they have developed a city agriculture plan, the first city agriculture plan in the Metro Atlanta area, and then also an equitable growth and inclusion strategic plan. Both of these have been centered on the community, driven by the community, and have been centered on equity. So it's a really exciting time to be working with leaders from a city like East Point and with the community of East Point, and to also have the opportunity to work with other community partners that have been doing this work for many years. So our partners for this project include the Partnership for Southern Equity, Voices for Georgia's Children, Food Well Alliance, and MLP Communications. I am happy to take any questions, or anyone that wants to learn more about our research or collaborate with us, please feel free to reach out to me at any time.